So, hi there, everybody. My name is Cathy Forbes. I'm the coordinator for the SHIP program in Mercer County, and I'm just going to go over Medicare in Mercer County for 2022. This will also be an introduction to Medicare. So, if you're new to Medicare or will be on Medicare soon, then this will be very useful for you. I don't expect everyone to understand everything by the end of this presentation. So if you have any questions or you would like a copy of the presentation emailed to you or any information mailed or sent to you, please do reach out to me. My telephone number is 609-273-0588. You can email me, or we also are on Facebook as well, although I would say phone or email is the best way to reach me. So SHIP stands for the State Health Insurance Assistance Program. It is a federally funded program that runs across all 50 states of the US, plus the 4 protectorates, which would be Guam, the US Virgin Islands, Puerto Rico, and Washington, DC. However, the name of the program does vary from state to state. Here in New Jersey, we have the federal name, which is SHIP. But for example, over the bridge in Pennsylvania, you will find the name is PA Medi. Down in Florida, it's Shine. And I say every time I do a presentation that Ohio is my favorite because they call it OSHIP, which is what I think people probably feel when they hear they're going on to Medicare. That's why SHIP is funded in order to ensure that you have access to local assistance from people who are not going to sell you anything, not going to tell you what to do, but to make sure that you have the information you need to be able to make the decision that is right for you. So who becomes eligible for Medicare? Well, you become eligible for Medicare either when you turn 65 or if you've been receiving 24 months of Social Security disability payments. That means that there will be people on Medicare who are under the age of 65. Now, if you are collecting your Social Security benefits when you become eligible, you will be automatically enrolled into Medicare. However, as more people may be choosing to delay their Social Security enrollment until they can get their full retirement benefits, and that is after 65, that does mean that more people are having to actively enroll in Medicare if they want it to begin when they turn 65. So that would be using the initial enrollment period. That period starts 3 months before the month of your 65th birthday, includes the month of your birthday, and then 3 months after. If you wait until after the month of your 65th birthday to enroll in Medicare, then there will be a delay before the Part B of your Medicare is started. So if you want your Medicare to begin when you turn 65, you want to really start the process 2 to 3 months before the month of your 65th birthday, so that everything is in place ready for the first of the month you turn 65. You do the enrollment is via Social Security. You do not have to be collecting Social Security benefits to be enrolled into Medicare. However, Social Security are the gatekeepers to allow you to enroll in Parts A and B of Medicare. If you are enrolling during that initial enrollment period, you go to ssa.gov, and through your My Social Security account, you can select whether you want Part A only of Medicare or Parts A and B. The reason you may not be enrolling in Part B of Medicare is because you are able to delay your Part B enrollment if you are covered through a large employer and either you or your spouse are actively employed and working to get those benefits. I will go over that again as we go through the slides, but just to let you know that if you have delayed your Part B enrollment, when your employer coverage is coming to an end, you get a special enrollment period, regardless of what point of the year that is, in which you can enroll in Medicare Part B. Again, this is actually being done online because of the Social Security offices being closed. And if you need the instructions on how to do that, just reach out to me by email and I can send you kind of the forms that you'll need to fill in and the process. Now, if you miss all of your enrollment periods and everything's gone wrong, there is a general enrollment period, which is always the first 3 months of the year, in which you can enroll in Part B of Medicare. As it stands, your coverage wouldn't start until July 1st, but you do want to try and make sure that if you need to have Medicare, because you have no creditable coverage from elsewhere, that you do make sure that you use your enrollment period. Now, I've talked a little bit and said parts A and B of Medicare, but what does that really mean? So a lot of the time people will say that Medicare has 4 parts. You will only see 2 of those parts on your Medicare card. That is Part A, your hospital insurance, and Part B, your medical insurance. Part C is very confusing because Part C is actually another name for Medicare Advantage plans. Because when Medicare Advantage plans were introduced a long time ago, they were conceived as a choice, a different way of how you pay or organize your Medicare. And C for choice, Part C. If you have a Medicare Advantage plan, it will generally cover your hospital insurance, your medical insurance, and your drug coverage, but it's all administered by the Medicare Advantage plan rather than by Medicare, and you have to have Parts A and B of Medicare to enroll in a Medicare Advantage plan. Part D of Medicare is drug coverage. Since 2006, it has become mandatory to have drug coverage if you're eligible for Medicare. That doesn't have to be a Part D prescription drug plan, but it needs to be something at least as good as a Part D prescription drug plan. It's very confusing because each part of Medicare has its own monthly premiums, its own deductibles, its own cost sharing rules of what you pay for services, and the rules for enrollment vary as well. That's why if you're unsure, please do reach out and I'll be happy to go through it. And I'm just going to talk through what you need to consider for each part as we go through the presentation. If you're a little bit more visual, this shows you what is covered by each part. So Part A of Medicare as your hospital coverage, that is your inpatient hospital stay, the skilled nursing care if you have to go to a rehab facility after a hospital stay. It would be hospice care and some home health care. Part B for boy of Medicare, that's your medical coverage. So it's basically anything that would have an office outside of hospital. So doctor's visits, surgery, lab work, medical equipment, medications that are infused, like chemotherapy medications would come under that, preventive exams, basically, surgery, sorry, anything, the ambulance trips, anything that's outside of hospital. Part C of Medicare, as I said, is a Medicare Advantage plan. So that is offered by a private insurer. It's going to cover the same things that A and B cover, but the out-of-pocket costs and the cover should be more predictable because you will have co-pays. It's not always, some of them it is co-insurance, but it's more fixed co-pays. And also the plans can offer additional coverage as well. So they can offer, for example, vision, hearing, and dental benefits and other supplemental benefits. Part D of Medicare, when you see that big R and little X, that tells you that that's prescription coverage. So Part D is your prescription drug coverage, and that would cover most of your prescription medications. As I say, just there are some Part B for boy medications, which would be those infused medications you'd get in hospital. Now, Part A of Medicare, your hospital coverage, for most people, there is no monthly premium. And that's because you've already contributed to Medicare through your withholding taxes. If you have what's known as 40 quarters, or you're married to someone who has their 40 quarters, there's no monthly premium for Medicare, and therefore there's no late enrollment penalty if you choose to delay your enrollment of Part A of Medicare until after your 65th birthday, or sometime after. If you have worked overseas for most of your life and have therefore not contributed to the Part A taxes, or you work for the federal government, then there will be a monthly premium for Part A, and it can be quite steep, or it is quite steep. So I appreciate that is an issue for some people, and you definitely would want to double check with Social Security what those charges would be. Now, Part A of Medicare, although it has no monthly premium for most people, the big cost is the deductible if you're admitted to hospital. You only have to spend one night as an inpatient, and you get hit with the deductible, which this year was $1,484. So pretty much $1,500 for one night in hospital. Now you then are covered for your bed and board for 60 days, and there could be co-pays after that. But the reason why I emphasize that deductible, and it is a benefit deductible, which means that if you are discharged from hospital and you are out of hospital for 60 days and then readmitted, you will have that deductible again, even if you're readmitted for the same problem. If there has been a gap of more than 60 days, the deductible comes back. The reason why I mention it is because it helps to explain some of the other costs, or some of the costs from the other insurances that you can get, as to why they're so high, because there is this big gap that Medicare doesn't pay for when it comes to Part A. Now, if you go to a skilled nursing facility, it does have to have what's called a qualifying hospital stay first for Medicare to pay towards it. That qualifying hospital stay generally means 3 midnights in hospital as an inpatient. Now, during the COVID-19 pandemic, that has been waived at times in order to move people through the systems faster. But otherwise, generally, you will need that qualifying hospital stay. You then get 20 days in your skilled rehab facility where Part A of Medicare would cover you in full. Beyond that, up to day 100, there are daily co-pays after that. I say that because it's important to know some people think they have to leave after 20 days, but depending on your insurance, you may what additional insurance you have, you may find that you do not have your co-pays are covered after 20 days up to the 100, and that gives you enough time to make sure that you are able to feel better and get fully recovered. Now, Part B of Medicare, this is the one which has the monthly premium that most people do know that they're paying, because you get $148.50 deducted from your Social Security check before it gets deposited in your bank. Or if you're not collecting Social Security benefits, then you will receive a bill generally for 3 months up front for your monthly for 3 months up front to pay your Part B premiums. Now, the premium is based on, if you did a tax return, it'll be based on your last tax return. So the 2021 premiums were based on people's 2019 tax returns, and the 2022 premiums will be set based on the 2020 tax return. So if you are what's considered a high earner, and that's what you were on your last tax return, then you may have a higher monthly premium for Part B. If that tax return is not reflective of your life now, because you've had a life-changing event such as losing your job or becoming widowed or so on, you can appeal that higher premium using the form SSA 44. If you Google SSA 44, the form will come up, or if you drop me an email, I can happily send you the copy of the form. On the flip side, if you're considered a low income person, so your annual income, and this would always be before any deductions, is less than $17,628 if you're single, or $23,757 if you're married, regardless of whether you would file taxes jointly or singly. If you're married, you're counted as a couple, unless you're separated and living separately. But if your income is limited to those numbers and you have limited assets, then you may be eligible for the SLMB program, where the state will pay your Part B premium for you. So I say to people, basically with Part B, someone is paying that monthly premium, whether it is you or the state. So you do just want to make sure that you're aware of it. Now, the Part B deductible in 2021 was $203, or is $203. Once you've met that deductible, then Medicare will pay 80% of the Medicare approved rate for covered services. This is the 80-20 split that a lot of people remember, because it's really easy to think of. So after the Part B deductible, it's Part B only, where Medicare pays 80% and you're left with 20%. Now, when we talk about the Medicare approved rate, what it is that Medicare assign a cost to each service or everything that you might get approved through Medicare. There is a cost assigned to it. If a provider accepts the Medicare assignment, they cannot charge any more than the Medicare approved rate, and it is a very reasonable rate. If the providers accept Medicare but not the Medicare assignment, in New Jersey, the most they can charge is 15% over that approved rate. It's actually very rare to find providers who don't accept the Medicare approved rate. If you needed to check that, you can always look on Medicare.gov under their provider search tool, and it will tell you if a provider accepts the approved rate. The 2 times I've seen it where somebody was charged that 15%, it was where they were seen by someone who didn't normally accept Medicare, did accept Medicare in this one specific circumstance, and then tried to charge whatever they wanted, which is just nowhere near the Medicare approved rate. So that 15% actually protected them from being overcharged. Now, you don't want to be paying $148.50 unless you need to. So you want to check whether you do need Part B enrollment once you become eligible for Medicare, or whether you can defer it. Now, if you are still working and covered by health benefits from a large employer, or you're married to someone who is working for a large employer and you'll get health benefits through them, you can delay your Part B enrollment. A large employer is an employer that has 20 or more employees if you're over 65, or 100 or more employees if you're on Medicare under the age of 65 due to disability. You do have to be working. So if your coverage through an employer is based on COBRA, if it's based retiree coverage, if you're covered by a small employer, if you have the Get Covered NJ marketplace coverage, or you have no other healthcare coverage, then you do need to make sure that you do enroll in Part B when you become eligible. So it has to be you're actively working and you're working for a large employer, and then you can delay your Part B enrollment. With that, when your employer coverage is coming to an end, ideally 1 to 2 months before it ends, that's when you want to contact Social Security to enroll into Part B of Medicare. Obviously, not everybody gets 1 to 2 months notice of when they plan to leave their job. So if you find out that you've lost your job or you're leaving more quickly than expected, just get in touch with Social Security as soon as you can in order to try and get your Part B in place as soon as possible. So Part C and D of Medicare, you're not going to see on your Medicare card. They are both optional. Part C, remember, Medicare Choice, now known as Medicare Advantage, which usually includes drug coverage, and Part D is Medicare drug coverage. Now, generally, you can't have both a Medicare Advantage plan and a Part D prescription drug plan, but there has to be an exception to every rule, and the New Jersey State Health Benefits Plan is the exception to that rule. Retirees can have both a Medicare Advantage and a Part D prescription drug plan, but if you're buying your own Medicare Advantage and plan or a Part D drug plan, it will be one or the other. You can't have them both. So you can't top up your Medicare Advantage plan with a Part D plan. Now, although the Medicare drug coverage is optional, it is mandatory to have drug coverage, and it needs to be creditable drug coverage. So creditable drug coverage is coverage that is as good as a basic Part D prescription drug plan. So that could be employer, union, or retiree coverage. And your insurance company can confirm if that coverage is creditable. Usually they send out a letter every year, but it comes out in all the information you get. Most people probably get rid of that letter without reading it. So if you're not sure, just give the insurance company a call. If you have drug coverage through a Medicare Advantage plan, that is also creditable coverage. What is not creditable is if you are only using a prescription discount card, so something like GoodRx, if you're enrolled in a drug manufacturer program, or if you have pharmacy or supermarket programs like Sam's Club. The reason why I mention this is because if you don't have creditable drug coverage, then when you do go to enroll in drug coverage in the future, you will be subject to a late enrollment penalty. Also, you cannot just pick up drug coverage at any point. You can only pick up drug coverage either during the fall, this open enrollment period, to start the beginning of the following year, or if there's been a change in circumstances. So, for example, if you have lost your other coverage, you lost your employer coverage, for example, or if you were released from jail, that actually gives you an opportunity to get drug coverage as well. Now, once you, when you've got those special enrollment periods at any point in the year, you generally have 2 months to enroll in a prescription drug plan. So if you're losing drug coverage, do make sure that you don't wait around before enrolling in a new drug plan. Otherwise, you will have to wait until the full open enrollment period, and there would be a late enrollment penalty that is calculated based on the number of months that you've gone without drug coverage. So Medicare coverage choices. As I said, Medicare Advantage is considered Medicare choice. It is an alternative to having original Medicare. If you have original Medicare, then you're going to show your Medicare card as your primary insurance. So generally that will be your Part A and Part B. So if you go to the hospital or the doctor, your primary coverage is Medicare. You can then add Part D Medicare prescription drug coverage, and you can choose to add a plan that pays after Medicare pays. There are some people who are fortunate to still be able to get retiree group health plans that pay after Medicare pays, or you can choose to buy your own Medigap policy. The alternative to that would be to have a Medicare Advantage plan, so that you are showing your one card for hospital insurance, and that's going to be whether you go to hospital, whether you go to an external provider like a doctor, or whether you are getting prescription drug coverage. Now, these plans are generally going to be either an HMO or a PPO, which means that there will be a network, and your primary coverage becomes that Medicare Advantage plan. That is your first and foremost coverage. So if you have original Medicare, what you'll see on your card is Part A and Part B. During open enrollment, you want to make sure you review your drug coverage so that you've got the best plan for you. And if you have got a Medigap plan, you can review that at any time of the year, but you do need to be aware that generally these plans are sold subject to medical underwriting, meaning that the insurance company will make a decision on whether or not to sell you a plan based on your current or past health history. There are situations where they must sell you a plan though, and that is when you have a guaranteed issue right. So a guaranteed issue right means that the insurance companies must sell you a Medigap policy. They must cover all your pre-existing conditions, and they cannot charge you any more because of your health history. So situations where this would happen would be within your first 6 months of having Part B. So this is another reason to not enroll in Part B of Medicare until you actually need it. But your first 6 months of having Part B of Medicare, if you're over 65, it's actually extended to 12 months if you're under 65. Then during that period, if you're over 65, you can choose any plan that is on offer in New Jersey, and you will not be charged any more than someone else of your own age, gender, and with your zip code. If you are under 65, then say this is extended to 12 months, and the Medigap plan that you would have a guaranteed issue right to buy is Plan D, D like David. Now, you also get a guaranteed issue right if you lose other healthcare coverage. So, for example, if you lose your Medicare Advantage plan coverage because you moved out of the service area, or that it's no longer being sold in your area, or if you had coverage that paid after Medicare pays and that is ending. Now, there's also an opportunity that if you drop a Medigap plan in order to enroll in a Medicare Advantage plan, maybe because you've seen a lot of the advertisements on television and you think that it might be a good fit for you, then within the first 12 months of doing so, and it only happens the first time you drop your Medigap, within the first 12 months, you can go back to original Medicare, get a drug plan, and also get your original Medigap plan back. After those 12 months, unless you're in any other guaranteed issue situation, you are going to be subject to medical underwriting if you want to buy a Medigap plan again. For the Medigap plans, there are 10 plans available labeled A through N. So you notice there's already some letters missing. And 2 of those 10 plans are actually grandfathered, which means they are only available to people who were enrolled in Medicare Part A prior to January 1st, 2020. And those plans are Plan C, like Charlie, and F, like Frank. Now, the coverage offered by each letter, each plan of each letter has to be the same. It is federally standardized. However, you will see variations in the premium cost, and that is because the premiums are based on what's being paid out in claims. So although every plan, G for girl, for example, must offer the same coverage, if you're buying that plan G from a company that has a lot of very sick people who are making a lot of claims, then the premiums will be higher than a plan G being offered by a company that just by good luck has a lot of very healthy people enrolled. Generally, you will see the premiums go up on a yearly basis. And that is because the premiums being based on what's being paid out in claims are affected by inflation and also the increasing costs of healthcare. Now, the premiums generally, it says $100 to $350. I would say they're more like $100 to $200 on the whole per month, but it does depend on the plan letter. The more comprehensive the plan, the more expensive it's generally going to be. It's going to depend on your age. The premiums go up with age and also gender. Unfortunately, gentlemen do have to pay more for their Medigap premiums, and that is because they seem to cost more. Now, some companies do offer a household discount. So if there are several of you living in your household, it may be beneficial to both go with the same company. And just remember, the premiums don't relate to your own health history because it is related to the population. So your premium would go up whether you go to the doctors once or whether you go to the doctors and you're in and out of hospital and having chemotherapy medication, so on. The claims will go, so your premiums will go up the same amount. Now, as long as you pay your premiums, you cannot lose your Medigap coverage regardless of your health status. This is why the companies do use medical underwriting to make sure that they are getting healthy people in who will be kind of propping up the system, as it were, by paying premiums without making many claims, which allows them to support the people who are making claims. Now, because Medicare is your primary coverage, you can go to any doctor, provider, or hospital that accepts Medicare in the 50 states of the US and the 4 protectorates. And the Medigap plans generally will help with those deductibles. The big deductible, remember that $1,500 for Part A of Medicare? Pretty much all of the plans will cover at least some, if not all of that deductible. And that's why you're seeing those premiums as being about $100 to $200 per month, because that's protecting you from a potential big cost. The plans will also help with some of the other copays and co-insurance, and the next slide will show you that. But just remember that the plans only pay after Medicare pays. So it will only cover Medicare approved services. They cannot offer extra benefits, such as dental, vision, and hearing, because they are not part of original Medicare. So here you can see, we call it a star chart. If you have a Medicare Renew handbook, you'll see this with check marks instead of stars, showing which gaps are covered by which lettered plan. It's very hard to read it on this chart. It's rather blurry. I can send it out to anyone who is looking for a copy of this chart that's not blurry, that comes as a fully printed page. But you will see that all of the plans apart from Plan A would cover at least some of that hospital deductible. The two grandfathered plans on the right, Plan C for Charlie and F for Frank, they were the only two plans who covered the Part B annual deductible. They have been grandfathered. I know some people worry that that means that they must be losing out if they can't get those plans, but I have compared a Plan F and a Plan G for somebody who was entitled to both of them because of their age, and they had a guaranteed issue right. And what we found was that the cost of the Plan F premiums over the year would cost more than $203 more than the Plan G. So it's the only real benefit if you're looking between the two with a Plan F is that you don't have any unexpected costs on medical. It's all covered in that premium, which can be helpful if you struggle with budgeting, but otherwise you're not losing out from going with a Plan G like girl instead of Plan F. The other plan that's particularly popular in New Jersey is Plan N, like Nancy. Tends to have a lower monthly premium because you do contribute towards it. You pay up to $20 for an doctor's office visit and up to $50 if you go to the ER and you're not admitted. So that helps to bring the premium down, but you're still protected from that hospital deductible. Anything, the Part B co-insurance, the big one there is if you're prescribed chemotherapy medications, because 20% of the cost of chemotherapy is big. So if you know that you've got that, it's just peace of mind. Plan D, like David, as I say, that is the only plan now available to people under the age of 65. Now, if you're having a thinking Medigap, that's, those premiums are pretty high. Talk to me about the Medicare Advantage plans. I see the adverts. I want to know about them. Well, you still have to have Medicare Parts A and B. That's like your gateway into a Medicare Advantage plan. So you have to have both parts to enroll in a Medicare Advantage plan. But what happens is that Medicare will pay, Medicare is the overarching entity, pay the Advantage plan provider about $1,000 per month for each person who is enrolled in that Medicare Advantage plan. That means that the Medicare Advantage plan companies receive about $12,000 per year for each person who is enrolled. They are then told by Medicare, you must make sure that that person receives at least the same care that they would receive under Medicare. But if you want to add extra benefits, you can do so, and you can set your own cost sharing rules. Now, by that means that very often the Medicare Advantage plan providers will keep low things like going to see your primary care doctor and blood tests, because that helps to keep you well. But when you need more healthcare, that's when you will be contributing more towards the cost of it. So, for example, if you're admitted to hospital and you have a Medicare Advantage plan, usually you will be charged around $300 to $400 per day for the first 5 or 6 days for an admission, which means that if you're in hospital for a week, you could be facing a bill of around $1,500 to $2,000. Now that sounds familiar because remember the Part A deductible was $1,500. So it's not too far different from what you would be paying under original Medicare with no additional coverage. Now, the other thing that tends to rack up costs is if you are getting durable medical equipment, dialysis, or chemotherapy medications. All of those come under Part B of Medicare, and generally the Medicare Advantage plan companies will charge you 20% of the cost as a co-insurance. Now, there is a maximum medical out-of-pocket in 2022. Once you've paid $7,550 in all of those different co-pays and co-insurances for in-network care, then the Medicare Advantage plan company has to meet the rest of your medical costs. So you're covered for the rest of that calendar year. It then resets. Most people never get to that $7,550, but I just want to make sure that you're aware of it, because that's kind of your maximum risk for costs for medical. Remember that with the Medicare Advantage plan, you do have to get all your services through the plan. So you want to make sure that your providers are either in network, or if you have a PPO, that they will accept you as an out-of-network patient or person. And bear in mind, you may pay more for out-of-network care. And actually the maximum medical out-of-pocket for out-of-network care joined with the in-network, but if you're getting it out of network as well, gets up to a maximum possible $11,300 in 2022. So during open enrollment, which we're in right now up until December 7th, it always runs every year from October 15 through December 7th. So if you're watching this after December 7th, then if you're not sure if you can make a change, give me a call. But you can review your Medicare Advantage plan choice, and you can also decide if you want to go back to original Medicare and pick up a prescription drug plan, a Part D plan. Now, it's very easy to go from original Medicare to a Medicare Advantage plan. There is no medical underwriting for a Medicare Advantage plan because it becomes your primary insurance, and you can't be turned down for primary insurance based on your health history. You can make that change every open enrollment. And if there's a Medicare Advantage plan on offer in your county, you can enroll in it. It's also very easy to go from a Medicare Advantage plan to original Medicare with a drug plan. You can do that again during open enrollment. Or if you have a Medicare Advantage plan come January 1st of any year, there's a special Medicare Advantage open enrollment, which runs January 1st through March 31st of each year. During that time, you can either switch Medicare Advantage plans or you can go back to original Medicare. But there is no guarantee that you would be able to get a Medigap plan, because unless you have a guaranteed issue right, remember that the Medigap plan would be subject to medical underwriting. So you could be turned down or you could be charged a higher price because of your health history. So if you're thinking about making a change, it would be worth, and you would think, I'd like to enroll in a Medigap plan, be worth contacting the Medigap provider ahead of time to find out whether you're going to get through the medical underwriting. Because with a Medicare Advantage plan, you do know that you've got that maximum out of pocket. Whereas with original Medicare with no additional coverage, although you have the flexibility of going to whichever provider you want, you are more at risk of paying. There's no upper limit, basically, that you could be being charged. Now, Part D prescription drug plans, these are offered by insurance companies that are contracted by Medicare. Regardless of the premium that you're paying, each plan must offer at least 2 prescription drugs in each treatment class. They cover the insulin and the supplies for injecting insulin, but not the test strips. They come under Part B. So if you have original Medicare, you can get whichever test strips you need. If you have a Medicare Advantage plan, you need to check which diabetes monitoring equipment, which company the Medicare Advantage plan will cover, because they do not cover every monitor or types of test strips. And I know that can be an issue. Part D prescription drug plans also cover most vaccines. So things like shingles. There are 3 exceptions to that. The pneumococcal vaccine, the flu vaccine, and the COVID-19 vaccine all come through Part B of Medicare rather than your drug coverage. Now, if you enroll in a plan and when you enroll, your medication is not on the formulary, you will be paying the full cost of that medication. If you start on a medication partway through the year and it would be covered by another drug plan, but not the one you're on, then you can request that it's covered as an exception for the rest of that calendar year. However, the expectation is that during the open enrollment period, you will look for a plan that covers that medication for the following year. So the exception only works for the first year that you start on a non-formulary medication. And if it's a medication that wouldn't be on any prescription drug plan, then it wouldn't be covered even under an exception. So Medicare will only cover what they consider to be medically necessary medications. They don't cover cosmetic or lifestyle medications or vitamins. So on the formulary, that's a list of the medications that are covered. Each Part D prescription drug plan will have assigned tiers to each of the medication. Tiers 1 and 2 are generally your generic medications and are going to be low cost. Tiers 3 and 4 will be brand name medications, and tier 5 will be the specialty medications you see advertised on television. Tier 6, not all plans have a tier 6, but where it does exist, these are clinically effective low cost medications. So generally the cost goes up from tiers 1 to 5. If there's a tier 6, it will be a lower copay. Now in 2022, the premiums in New Jersey for a prescription drug plan range from $7 to $100, and the median premium, that say 2022, is $37.20 per month. The deductible this year for 2022 has been increased from $445 up to a maximum of $480. During the deductible period, you're paying the full cost of medications up to the deductible limit before the insurance company will start contributing towards the cost of that medication. Now, the deductible amount does vary between plans, and it may only apply to certain tiers. So, for example, you may find that it's only tiers 3, 4, and 5, and therefore you're paying a reduced cost for your medications from day one for your generic medications. Now, once you've met the deductible, or for those plans with no deductible, you go into the initial coverage period. Now, during that period, you will pay either a fixed copay or a percentage of the drug cost that has been defined by your insurance. So it will be in your plan benefits. Once you and the insurance company together have paid $4,430 towards your medications, you go into what is still known as the coverage gap. Now, that means that you may not have paid very much towards your medications, but you could still find yourself in the coverage gap because it's the amount that the insurance pays that counts as well. So, for example, if you've paid the $480 in a deductible towards a medication, and then after that it's only a $45 copay. If the insurance is picking up $1,000+ for that medication that you're not paying but they're paying, you can quite easily get to that $4,430 before you know it. And in the coverage gap, you would pay 25% of the cost of your medication. It used to be 100%, but that gap has been closed, so it's now only 25%. If you're on a tier 4 medication, very often during the initial coverage period, you'll be paying around about 47, 48% of the cost of your medication. So you can actually see some people see their drug costs come down during the coverage gap. However, if you've been paying $45 for a $2,000 medication, you will see the cost of your medication go up during the coverage gap. Now, to get out of the coverage gap, again, it's the amount that you and your insurance company pay towards your medications. Once that hits $7,050, you go into the catastrophic coverage, at which point you pay 5% or a fixed copay for your medications for the rest of the year. And then the remainder is paid by the insurance. So some people will never even meet their deductible. Other people get through and are in catastrophic benefit after filling their prescriptions once. It really depends on the medications that you take. So in New Jersey, you're choosing between 23 plans for 2022. That's 7 less than last year for 2021. The lowest premium plan is the same. It's still SilverScript Smart RX, which is $7 per month. And there are 2 other plans with monthly premiums under $20, ClearSpring Health Premier RX and WellCare Value Script. Now, both the ClearSpring Health Premier RX and the WellCare Value Script do not charge a deductible for tiers 1 and 2. However, the SilverScript Smart RX does have the deductible from tier 2, and also the co-pays for tier 2 medications once you've met the deductible are pretty steep. They're like $19, whereas I think on the others, I know with WellCare it's $4 for a tier 2. I can't off the top of my head tell you the ClearSpring Health. So SilverScript Smart RX is great if you don't take any medications, but just be aware that you may be paying more if you do start taking medications during the year. Now, 4 of the plans have a $0 deductible across all the tiers. 12 of the plans have $0 deductible for some of the tiers, including those 3 plans with premiums under $20 a month. And 7 of the plans apply the full $480 deductible to all the tiers. Some big changes that are happening for 2022. One is that Express Scripts has been bought out by Cigna, which means that anyone who has an Express Scripts plan this year is being moved to a Cigna plan. Do make sure that you have a look at which Cigna plan you're being moved to, because some people are being moved to a $64 per month plan and it's not the right plan for them. Unicare, no one in Mercer County had this, but other counties I know there were people enrolled in the Unicare Medicare RX basic plan. It is not renewing. So if you've had that and you don't get a new plan by December 31st, don't get a new plan, then come December 31st or January 1st, you're not going to have any Part D drug coverage. WellCare is also consolidating their plans. They're going from 6 to 3. So again, people will find they're being moved to another plan. And so anyone who's on any of that, who has plans from any of those companies, I would definitely say open your mail and make sure you review your coverage to ensure that you have the right plan for you. So how do you, the senior savings model, this was new last year. It's still in a trial phase, so not every company offers this. It really only relates to if you take insulin. It's not all insulins, it's not all Part D prescription drug plans or Medicare Advantage plans for drug coverage. But the aim is to try and make insulin costs more predictable as you go through the coverage phases. But you do need to be aware of the costs of your other medications. And because you're getting such a big discount on the insulin, you can find that other medications do become very expensive because you go through the phases quicker. So how do you find the most cost-effective Part D prescription drug plan, and how do you find out what your costs are going to be going through the year based on your current medications? Well, SHIP counselors use this. You can use it at home, but if you need any help interpreting, give us a call. But it's the Medicare.gov Plan Finder tool. You just enter your current medications, the dose that you take, and how often. You enter your preferred pharmacy, and that can include mail order as well. And you can choose up to 5 different pharmacies. And basically, the Plan Finder will churn out all 23 plans in a list of the lowest cost for the premiums and the medications together first, and then going up. So you want to look at those lowest cost options. The main thing to check for is coverage restrictions. So make sure that if there are quantity limits, that works with what you're taking. Generally, the quantity limits are not an issue. They're usually around safety. So most people are being prescribed within them. Prior authorization, again, if your doctor thinks you need something, it's not going to be hard to get them to do the prior authorization. But the step therapy is the bit that you want to watch out for. Step therapy means that you're going to be asked to try other medications before the plan will cover that specific medication. And if you've worked hard to find the medication that's right for you, then having to step back and do step therapy may not be worth it. You definitely want to review your plan choice every year during the annual enrollment period, which is always October 15th through December 7th. I just spoke to somebody earlier today, and by changing their plan, they're going to save $900 next year, and they just didn't know that they needed to review it, which is fair enough. They were happy with their plan, but why not make a change? That's $900 back in your wallet, and you can spend it on whatever you want. However, medication costs are expensive, and I know that. And there are programs that will help with Part D prescription costs. There are 2 plans that are only available to people in New Jersey. One is the PAAD program, which is more generous, and the other is the Senior Gold Prescription Discount Program. Now, the income limits are going to go up by $10,000 for each plan next year. So if in 2022 your income gross is going to be less than $38,769 annually if you're single, or $45,270 if you're married, then you're going to be eligible for the PAAD program. And I really encourage you to apply. And if your income is another $10,000 above that per year, then you'd be eligible for the Senior Gold Discount Program. There is a federal extra help program as well. You get enrolled into that if you're on Medicaid, or if you get assistance with your Part B premiums, and you can apply for these programs through the NJ Save application. Now, NJ Save, you can apply on paper, but it will delay the processing. So I do encourage people to apply online. But I know not everybody, well, I hope you're watching this, so you probably have a computer, but I know not everyone has a computer, or you just may not want to do it yourself because it's a lot of questions and it's hard when they're about yourself. So you can give us a call at SHIP. We will go through the application with you. We'll make sure that you know what you need to include, and we can double check the figures for you. Also, the screens for utility assistance, and we will screen you as well to see if there's any other programs that we can help you with. So just give us a call and we'll be happy to assist. So Medicare Advantage plans, well, these are also offered by insurance companies that are contracted by Medicare. Like I said, they're going to be either an HMO, which means there is a fixed network, or PPO plans. Now, there are some HMO POS, which stands for point of service, nothing else, plans. And with those, you may be able to go out of network if you get a referral. But generally, you have to get all, well, you do, it's not generally, you do have to get all your medical services and medications through the plan. So you may have to use those specific providers. You may need a prior approval or a referral. And the co-pays for the services do vary between the plans. When we're comparing the plans, and I just have it now, we have a Medicare Advantage comparison chart, which allows you to look at the costs. Because if you watch something on television, the big news is going to be how much it costs to go and see a primary care doctor, maybe a specialist, and also what the cost is if you go to the ER. But you want to know, what's the cost if I'm admitted to hospital? How much does an ambulance trip cost? What's surgery going to cost? So that you can kind of map out in your mind what those costs look like. And also, if the plan is offering additional benefits, what do they look like? Are they benefits you're even going to use? Do you think they're going to work for you? Because you don't want to be enrolling in a plan thinking, oh, it offers dental coverage, if when you look at it, it's not the type of dental coverage that you're looking for, because it may only be preventive care, for example. Now, all the claims are processed by the plan, not Medicare, and you're only going to use your insurance plan card. But remember, you still have Medicare. It's just that Medicare are paying the Advantage plan company to look after your health. As I said, you can get additional benefits that are not otherwise available under Medicare. The big ones everyone remembers is vision, dental, and hearing, and also gym membership. And since 2019, the plans have been able to offer even more benefits. Some of that has included comprehensive dental, maybe home delivered meals after a hospital stay, or over-the-counter spending cards. And you really want to check with the plan as to what's being offered and what the limits are. The premiums for Advantage plans in New Jersey are going from $0 up to $115 in total. And it is payable in addition to your Part B premium, because you have to have A and B. If you have PAAD or extra help, then they will help pay the drug cost portion of the premium, if there is a drug cost portion. And so you may be able to get a plan that has a premium at either a discounted rate, or it'd be $0 per month for you. And you still get your medication costs capped at the pharmacy counter. So again, if you're eligible, give us a call. Now, the primary doctor copays range from $0 to $35, and the specialists generally from $5 to $50. But like I said, remember the cost of other items. So for example, an ambulance trip is generally around $250. And it does have to be medically necessary. Medicare and the Advantage plans are only going to cover medically necessary items, which means that you either needed to travel flat to hospital, like on a stretcher, or you needed monitoring during your trip, just because very often ambulance trips are denied. But look at what's the cost of outpatient surgery. Do you get a discount if you go to a walk-in surgery centre, the ambulatory centre, compared to in hospital? What's the cost going to be of an MRI or an X-ray, and so on, and therapy? Remember, the maximum out-of-pocket costs on medical will be capped at $7,550 for in-network care. And if you have more care after that, then the plan has to pay the costs for it. But it's only for medical. It doesn't cover your prescription drugs. unless they were the infused chemotherapy. Most people never get to 7,550, but if you're in and out of hospital a lot, or you are having infused medications or a lot of durable medical equipment, you might get up there. Now, there are Advantage plans out there which do not have drug coverage. They're very often aimed at military veterans. So they have names like Eagle and Honor and Patriot. And so that's because if you're a veteran and you have drug coverage through the VA, then that is creditable coverage. So you don't need to get separate drug coverage, but you do have to fill your prescriptions at a VA pharmacy or facility. If you like the look of the Advantage plan without drug coverage and you think, well, I'll get a Medicare drug plan to go alongside it, no, can't do that. It's one or the other, whether or not your Advantage plan has drug coverage. And if you don't have creditable drug coverage, then you will be subject to that late enrollment penalty if you later decide to enroll in Medicare prescription drug coverage. But if you've gone a long time without drug coverage and the late enrollment penalty would be prohibitive, then there are Advantage plans out there without drug coverage, so you wouldn't have that late enrollment penalty and you'd still have no drug coverage. Now, in total in Mercer County, we have 38 different Medicare Advantage plans. 5 of them have no drug coverage. 19 of them are HMO plans. 17 are PPO plans, which is a big increase over the past sort of 4 or 5 years. And all of those plans offer some sort of vision, dental, and hearing coverage, as well as fitness benefits. Now, 16 of the plans with drug coverage have a $0 premium per month, and it should actually say 4 plans offer a discount on your Part B premium. So if you're paying a Part B premium, you can get a discount, but you'll generally find that as you use healthcare, that the co-pays will be higher. If you already have a Medicare Advantage plan, and even if you're happy with it, just make sure you look out for mail from the plan during this time. See if the premium is changing, are the benefits changing, and are the prescription costs changing? Just make sure you're happy with it. But how do you review and try and work out what is the most cost-effective plan? Well, you can use the Medicare.gov Plan Finder tool to check the cost of your medications, same way as you would with the drug plan. And then you want to use our Medicare Advantage Plan summary chart for the county so that you can compare the costs of medical care, additional benefits, and deductibles. The charts are now available. We do have that. So if you would like a copy of the chart, you can just drop me an email or give me a call and I can mail or email it out to you. Do you make sure your doctors are in network if you can? Just be aware they can leave the network at any point in the year, but they can also join at any point. So if you're very persuasive, you might be able to get a doctor to agree to join the network for a specific plan. You can review your coverage, as I said, during this Medicare open enrollment period, which is always October 15 through December 7th. And then again, between January 1st to March 31st. So if you make a change and you get a bit of buyer's remorse, you can change back or change to another plan. Or if you're enrolled in a plan, you suddenly go, wow, my friend's got this plan, it's so much better, I wish I'd changed. You've got the opportunity to do that. You can only make one change and the change will become effective the 1st of the following month. So just as final reminders, if you have either original or a Medicare Advantage plan, make sure you take advantage of any free and reduced cost preventive benefits. So things like your flu shot, an annual wellness visit, and various screenings. Now, the screenings will only be covered at a certain frequency. So see your Medicare and New Handbook or look at Medicare.gov online for a full list. You also always, I just like to say, just beware of scams. Your Medicare number may no longer be your Social Security number, but it still provides people with access to a lot of information about your healthcare. And please don't give people your Medicare information or your bank account information in exchange for them coming and asking for COVID-19 testing, treatments, supplies, vaccines. Just make sure that you know who the people are that you're giving your information to. COVID-19 vaccines are available at no charge to anyone who has Medicare Part B. Doesn't matter whether you have an Advantage plan or original Medicare, the vaccines are free. And just as always, I know I've said it loads, but the enrollment period is running till December 7th. It is a hard finish at midnight on December 7th because Medicare is a big national organization, and they do not have time to listen to anybody's reasons for why they missed that cutoff. So do make sure that you have any changes locked in by midnight on December 7th, but SHIP is here to help. So the preventive benefits, here is a list, but it doesn't give you the frequency, but you can see that there's a lot of different preventive benefits trying to keep you well. And then if you need to reach out to us, you can call or text. It is just me answering that number. So that means that I can't always pick up. So do leave a voicemail. I'll try to get back to everybody as soon as I can. But obviously, if I'm on the phone or giving a presentation, I'm not going to be able to answer. You can also text me or email me, so you don't even have to speak to me. You can, as I say, follow us on Facebook. I'll be honest, right now I haven't been very good at keeping it up to date. So do keep an eye on things like the Trenton Public Library website, because you can watch things like this presentation and get your information. But do get in touch if you need help applying for programs that are being aimed at Medicare beneficiaries with a fixed or limited income. If you need help reviewing your choices and costs, whether that's because you're joining Medicare or you want to review your coverage for the following year, and also just any other Medicare question that pops up, please ask us rather than just the general person in the street. And that is it. Thank you very much for taking the time to listen to this presentation. And as I say, I'm not expecting you to have understood everything about Medicare during this time, but hopefully it gives you an overview, and then it gives you an idea of what questions you might want to know more about. And just get in touch and I'll be happy to help. Thank you very much.